physical responses to the stimuli, to the point where lights bother them, touch bothers them, the tags inside the clothes, the textures, new things. So it's just the brain is designed differently.
If you are suffering from anything, just take help.
We can thank TikTok.
Yeah, of course.
So the good thing about ADD meds or ADHD meds, you can also have them as what we call like a PRN, which is, it's prescribed as needed. But you can take days off where you don't take the medication, and then have days where you take the medication.
Mehta, what are some common misconceptions or misunderstandings about ADHD you would like to debunk?
I think the biggest misunderstanding is somehow there's something wrong with the brain. It's just a different brain. And the work is on us to figure out on how it's different and then accommodate. People with ADHD or ADD are not dumb.
Namaste everyone, I am Shilpi and I'm the proud host of Safarnama with Shilpi. Thank you for watching my videos and supporting my channel by sharing with others and subscribing. Your encouragement means the world to me and it motivates me to create the content that truly matters. Today we will discuss an important topic in our mental health series, Attention Deficit Hyperactive Disorder. ADHD is a neurodevelopment disorder characterized by symptoms of inattention, hyperactive and impulsivity. It can affect individuals of all ages through it is often diagnosed in childhood. The impact of ADHD can be profound, influencing academic performance, workplace, productivity, relationships and overall quality of life. Today we are honored to have Mehtab Moradi with us. Mehtab is a licensed therapist with over 22 years of experience in counseling psychology. She serves as the secretary on the board of directors for the Rupani Foundation USA and has made significant contribution to mental health services through her work with Crow Therapy and the Ibn Sina Foundation. Mehtab's extensive background in psychology, counseling, and behavioral management has equipped her with a wealth of knowledge and insights, particularly in the realm of children's mental health. This important topic has been brought to you by India House in collaboration with Hawk Foundation and Asian American Health Coalition. India House Houston is a vibrant, non-profit organization dedicated to uniting culture and enriching the greater Houston community. Through its diverse range of free programs and services, it addresses critical needs such as healthcare, legal aid, education, and wellness. From food distribution and charity clinics to yoga classes and cultural activities, India House fosters inclusivity and provides a welcoming space for people of all backgrounds to connect, learn, and thrive. So please help me welcome our today's guest, Mehtab. Thank you so much for coming.
Thank you for having me. I'm glad to be here.
Mehtab, before we dive deep into the discussion, let's take a moment to understand a condition that affects millions of children and adults worldwide. Attention Deficit Hyperactive Disorder or ADHD. Imagine a world where focusing on a single task feels like trying to catch a butterfly in a whirlwind, where sitting still is constant battle or impulsive action seems to take over. This is the reality of many individuals with ADHD. In fact, I remember a close friend of mine who struggled with ADHD throughout his life. He was incredibly bright, creative, but he often found it difficult to concentrate in school. His mind was always racing with ideas, but staying focused on one thing was a challenge. And despite these hurdles, with the right support and strategies, he learned to harness his unique strengths and thrived. So, Mehtab, I want to discuss ADHD today. So, before we dive deep into the discussion, what does ADHD really means? Can you please explain it in simple terms?
So ADHD or ADD, the H in ADHD stands for hyperactivity. These are cognitive disorders. They usually impact executive function. They impact the way we control impulses and our concentration. So our ability to start and finish a task, our ability to like build upon a task like from one stage to the next, how much time we can kind of retain and be attentive to a task. And so you often see early signs of it in childhood, because a child might get extremely hyper or distracted very easily. That doesn't look like the normal like behavior for that age group.
Is it only for child specific?
No, you can have a lot of adults go through their whole life that they do not get detected.
Okay.
And they'll say, especially this is the case for boys, because they'll just say, boys.
Is it gender basis also?
There is some differences, even though both genders suffer from ADD and ADHD. There is a cultural bias on boys, because people will say, oh, boys will be boys. He's climbing that wall. Oh, no worries. We make kind of excuses for it. Also, high IQ often hides some of these things. And then the parents' kind of lens of the world. Like sometimes we don't want to look at our child's problem areas because we're too.
So, if he
skewed.
has a high IQ, then that is also a problem.
Well, the ADD and ADHD is it's not just, oh, you have these features and you have this diagnosis. It's like depression and anxiety. It's a continuum. You can have mild, you can have it to the point where you're extremely you're sensitive to lights, you're sensitive to like texture, to tags inside your clothes. You have somatic response. You cannot sit still to do very much without medication management. And then you've got where we've got people who have what we call Asperger's, or what used to be called that. And that is, they're very high functioning. They know a lot about so many different topics, and they are not hyper, for example. They are able to get things done. They don't need the medication. Sometimes they need more techniques, more approaches. Like nowadays you'll see some kids with, like, you can actually have these, where they drown out the sound, the headphones, or we've finally got to a stage where we can help train teachers and people in schools to create a setting for a child that becomes easily distracted or hyper, and where maybe their chair is just a little bit tweaked and they're not sitting in front of all their peers, where they can still get some work done. We could accommodate kids by giving them, a little bit more time, or even like dividing. Let's say a quiz is 15 questions. And just by the way we present the quiz to that child, and I call it make friends with your brain. And when I work with kids on that spectrum, we all have a unique brain. Yours just has this label. Right? We all have something going on,
of course,
that we need to cope with ourselves. But the accommodations help that person.
So, according to you, it is all about brain digestive system.
Yeah.
Yeah.
Our cognitive processes.
Yes.
And how we receive stimulus from our environment.
Understood.
Maybe you're sitting there and your son could be playing his favorite music your husband could be cooking and you could still do this. Or you could still write an email.
Yeah.
For someone else, that may be an impossible task.
Yeah.
They have to completely drown out those two other noises.
Understood.
Or let's say you go to a party. I mean, imagine how many unpredictable, dynamic things are happening when we go into a space where there are multiple people doing different things. And your brain likes it a certain way.
Yeah. Yeah.
Right? So there's a show, actually, I love it, and it's called Dating on the Spectrum.
I saw this.
That's such a good capture.
Yeah.
Because I honestly feel like these people are doing a much better job with dating than the ones who claim they have a normal brain. They've actually taken the time to learn. And if you pay attention in that show, you can very easily spot whose parents got them like earlier help.
Yeah.
Because some of them, they know what to say. They have, pro-social skills. Pro-social skills basically means that in a setting, environment where there are other people, you have the appropriate responses. You can read the situation, which is very much a learned skill for someone who struggles with all the stimulus. And it's like there's a flood of interactions going on and they just want one response. So like I'm treating this couple right now. One has anxiety disorder and the other one has untreated ADHD, and he's really trying to not be on medication because of his GI issues that he had before from being on medication.
So are there different types of ADHD also?
Yes.
And how do they manifest in individuals?
That's going to be like case by case. Like if you want to go as young as 3, 4, you compare that child's behavior and their ability to execute cognitive tasks for that specific age. Then we use what they call the Conners intake, which is, kind of like an interview on that child's behavioral habits based on like a teacher's report, maybe a grandparent that is with them all the time, and mom and dad. Because you really want to make sure that the context is appropriate. So that there's no misdiagnosing.
Yeah.
Right? Most people go their whole lives, and I think this has gotten attention more recently. But like when I was going to school and we started, treating ADHD and ADD, many children would give them the diagnosis of antisocial, like basically labeling them pre-criminal before they would go into the specifics. But then a lot of advocacy has happened since then. A lot of attention has been brought to Congress and, lawmakers. And now we actually can request for these things. And they're called IEPs, the Individualized Education Programs, which basically means we honor that these kids have unique needs and that they can thrive in the right environment. So we are willing to make the accommodations. So when parents start seeing these signs early, it's important because they can get their child the resources they need, which will help, I guess, the impact of the disorder on their lifespan. I don't know if I'm saying that right.
Yeah. So if we, just want to dive deep in a layer deeper.
Yeah.
Like, let's say how, if I talk about the branches of ADHD, how many different types? Like,
So
if we can do the bullet points on this.
That's going to be its own presentation because each one then has the criteria, which is like, 20 something things that fit.
Okay.
But
if we talk about top 5.
If we summarize it, it's literally our response to social stimuli,
Okay.
then cognitive
Okay.
functioning,
Mm-hmm.
and then even like the self-regulation. At the more extreme, there is very heightened actually physical responses to the stimuli, to the point where lights bother them, touch bothers them, the tags inside the clothes, the textures, new things. So it's just the brain is designed differently, right?
Yeah.
Just like for anxiety, let's say, if you giving a public speech in front of 500 makes you anxious, for another person, just getting up and going having a coffee with a friend makes them anxious.
Understood.
So with mental health, you have to really understand what that means for that person and how it's affecting their daily functioning.
So how is ADHD diagnosed?
There's a couple of rounds of it. At the very high, I guess, acuity, it's very obvious, and parents usually are screaming in the early, before age 5. Parents, caregivers, babysitters, daycare, they are noticing things. But if it's more subtle or more moderate, then it starts kind of showing up when the child mixes in the school setting, because still the home environment is predictable, and moms and dads make it comfortable, right?
Yeah.
So we may miss some folks in that space for the more moderate.
Understood. Yeah.
And then there's also, actually not just with ADHD, but other mental health diagnoses, there's an uptick right around the time of adolescence.
Okay.
Because then new hormonal changes and the shift to, social, them being around peers, social pressures, all those things really heighten anxiety, depression, and ADD. So the peers then are like, oh, this one is weird. Why do you always say the wrong thing? Or how come you act like that? And we as a society, we miss it.
So does the diagnose, if we talk about the diagnose, so does this diagnose includes both mentally evaluation and behavioral assessment?
Yes.
Okay.
Usually the starting point is, if it's a school age child, it's a teacher calling help to the school counselor. And then the school counselor is engaging the parents, because in school, most school counselors are not licensed to diagnose.
So school counselor does the assessment of behavior and mentally.
They can complete a Connors.
Oh, okay.
The Connors survey. You could call it a survey assessment. A teacher can do that. But someone like me or a child psychiatrist, we can actually conclude a diagnosis. But they can help tell us the story of, oh, how does, Abby act in the playground? How does she do in art class? How does she do with new peers?
Yeah.
Do mom and dad say the same thing about her at home? And then we begin kind of capturing a clinical picture.
Yeah.
So then at that stage, they hand it off. They make a referral, usually to a counselor. And so then we do further investigation. And then if we feel like this child or even this adult needs a little bit more help to be able to, thrive or be successful in their environment, in their daily routine, and the tools in counseling are not enough, then we make a referral to psychiatry.
So how does ADHD symptoms different, from child to adults?
So I guess the biggest difference is sometimes living with it over the years teaches you how to manage some aspects of it. And so you'll see in adults, they will use different ways to kind of minimize their symptoms, or they kind of know. And in college students especially, I get a lot of college students that realize this is something they suffer from. Like, but I didn't know what this was, but I am kind of, this bothers me, that bothers me, I can't do this, I need this. And you could tell that person, because human beings are very smart, we kind of figure out how to
Mehtab,
cope.
you see these cases on a regular basis, right? So, I mean, what if I ask you just to give me a conclusion? What is the main reason behind it? Why the teenagers, especially in USA, at the age of 14, they start, showing up these kind of symptoms? What's the biggest reason you found out after seeing all the cases?
So what we call the whole word, when it starts in clinical language, is called onset, right?
Okay. What's that mean, onset?
Like when the behavioral symptoms or sequences start being
Understood.
noticeable,
Understood.
right?
Yeah.
So like, for example, in diabetes, sometimes they say, oh, the onset was gestational. When the woman was pregnant,
Yeah.
that's when the diabetes
Absolutely.
started
Yeah.
appearing. It's often the case that the symptoms were there before adolescence. Someone just didn't do anything about it. And then it got kind of exaggerated by, again, the change of adolescence and the brain. Most behavioral issues do get exaggerated by that age, if that makes sense.
Yeah.
And then what you want to have is a clear diagnosis way before that, so that the child has enough time to self-regulate, to understand and get along with their behavior before having the onset of adolescence, where then they have to manage the peers, then they have to, work on other things that affects their self-esteem. Because if you don't have an early intervention, then you're putting that child more at risk for going about it the wrong way, to self-manage. Maybe they're more likely to vape, to drink, to do other things to kind of calm that brain.
Yeah.
So that, again, I cannot emphasize the earlier detection, because you save that child a lot of headache.
Yeah.
And you give them time to adapt.
So what kind of challenges do people with ADHD typically face in their lifestyle or in daily life?
It's very chaotic. It's disruptive. People around them sometimes judge them because they're like, why aren't you listening to me? You changed topic. This is a lot of times with the couples that I work with. And that goes back to that executive function, being able to hang on to a thought. And it's amazing. It's a night and day shift when they take medication or they've got counseling. In the beginning, we always recommend both until the person has a good grip on the situation.
Understood.
Just like we do with diabetes. You have diabetes, go see a nutrition and your internal medicine doctor.
Why do you think ADHD diagnoses have increases so much in recent decades? And could there be underlying factors?
I think awareness and advocacy, people know more of what to look for. That's why there's more diagnosis. And I don't know. I mean, I'm not.
That's a good thing. That's a good thing also, because if you are as we are in the mental awareness month, there's a reason behind it. That if you are suffering from anything, just take help.
We can thank TikTok.
Yeah, of course.
Because a lot of the adults that are calling me for, like, oh my God, I've just been married a year. My wife, I'm driving her crazy. I think I need an evaluation. And
you're right. Absolutely.
I had ADHD. This is what happened. Or ADD. Adult ADD. And it's harder to get, it takes a little bit more assessment to kind of seek the help you need as an adult, because sometimes people have abused that system, because ADD drugs are often used for people who want to, outperform others, because they're known to help you focus. They're appetite suppressants,
Yeah.
so you're focused and skinny. So
Yeah.
those are, how much of a commodity
course.
that is.
Absolutely, absolutely. So, Mehtab, what role does medication play in treating ADHD?
For the more like moderate to severe, it's absolutely a game changer. But for the
So, are these medications for a certain time or for a life?
So the good thing about ADD meds or ADHD meds, you can also have them as what we call like a PRN, which is it's prescribed as needed. So let's say you work a job and the most important part of your week is Monday through Thursday, 9 to 3.
Yeah.
So you can technically, I mean, obviously, these are all depending on what class of medication you're taking, if it's stimulant, non-stimulant, what other clinical picture there is. But you can take days off where you don't take the medication, and then have days where you take the medication.
So, are there any long term and short term effects also of these medications?
Yes. And this is something I would need you to pursue this conversation with like a psychiatrist, because that's not my area. But from what I know, the stimulants do have they're more addiction prone.
Oh, really?
So if someone has a history of addiction in their family, like, or if they're genetically they have that predisposition, I believe like the provider would not go for that. So that's another reason you got to communicate, kind of give all the facts to your doctor, and it's one of those things we take seriously, to have the full picture before you go for medication management.
I did a podcast with Sujan Shah. He's a mindfulness coach. And
Okay.
yeah, what he's suggested that if you are suffering any kind of mental health issues, mindfulness can help.
Absolutely.
Yeah. So,
Yeah.
can lifestyle changes like exercises or mindfulness actually improve ADHD symptoms? Do you really think?
So I love mindfulness. I think for low to moderate anything
Yeah.
is great.
If you love mindfulness, you should watch that episode. Sujan Shah was excellent. He elaborate everything. What's the mindfulness in a very simple definition?
Yeah.
Yeah.
I don't think mindfulness is the cure for
ADHD.
all mental health, and that includes ADHD.
Okay.
Some people truly need extra help. Now, will it help them with coping? Will it help them with grounding, self-regulating, self-compassion? Who doesn't need all of those
Of
things?
course.
But if I had an infection and they're about to cut my foot off, I would need my antibiotic,
Absolutely. Yeah.
and I've seen a lot of folks, especially in our cultures, go through a lot of suffering because they just want to hang on to praying and mindfulness, and they're ignoring major red flags, and their illness is getting worse gradually, and they refuse. I think we have to know when science needs to come to save us, and when to rely on ourselves and I believe spirituality, mindfulness is one arm of mental health. And that's why we have to take the time, have the right conversations. But sometimes it could be a supplement.
Yeah. Mehtab, how does ADHD impact someone's daily life, daily routine, relationships, and mental health being?
So in in regards to relationships, especially because that is part of our daily life,
Yeah.
it varies, right?
Yeah.
If you're a child, you're gonna be that child.
Let's say just break it down.
Yeah.
If we start from child, teens, and then we go for like if we are in our 30s, how does it impact?
So in children below, I guess, early childhood,
Mm-hmm.
it often looks like alienation,
Mm-hmm.
less friends,
Mm-hmm.
not getting invited to parties sometimes because sometimes the parents get alienated as well.
Yeah.
In adolescence,
Mm-hmm.
it could look like those self-esteem suffers.
Mm-hmm.
People who live with ADD or ADHD are prone to depression. They're prone to anxiety. They are at risk for substance use and abuse because of the rejection that sometimes society, by not understanding, lacking empathy, not being inclusive, they kind of turn inward. And then in adulthood, it looks like partner rejection, the inability to maintain relationships, labels, employment.
Yeah, of course.
If you're not medicated and you cannot finish, you're always late on deadlines. You're not getting, if you're late, then you're not getting paid.
Absolutely.
So it just looks different, and I think I'm so happy that there's so much awareness campaign around that because I would hate to live with something and struggle and not know what it is and not get the help I need. And I wish I could I've clocked in over 30,000 hours of counseling in my 24 years. And I wish I could take parts of those conversations and tell the world like how life-changing that is. How many marriages were saved because somebody had enough guts to say really what was wrong. Or a mom didn't care what her, faith community thought and just took her child to get the help they needed, and how that changed that child's life. Or how somebody was brave enough. And I have older sisters saying, my parents don't believe in this, beep crap.
Yeah.
And she brings her sister and she prevented a suicide.
As we have discussed that therapies always help.
Mm-hmm.
Can you navigate any success story about ADHD who got help?
I think, the most recent success story is this couple that I'm working with.
Okay.
And she's extremely anxious and he's extremely ADD.
Oh.
And it's very cute, and they're both learning to navigate themselves and the relationship.
So how many sessions they required?
If you want to see anything impactful, I think at least 10 to 12 sessions. For people who are well-read, if you're actually the kind of person that takes it seriously, you come into your session to do the work, and then you go do your homework.
Yeah.
I think, 10 to 12 sessions can be life-changing.
Can you give just an idea, how much do a couple or children, I mean, it depends upon the case, of course, do they have to pay? I mean, it's just a lump sum idea.
So in the free market, it's more expensive. If you don't have insurance.
What's that free market? Okay, if you are not going through the insurance.
Well, I work for a nonprofit where we have very low fees. Like you can go see a psychiatrist, $59. You could see a therapist. Like we run specials. We're trying to, help people with barriers. But I don't know, in Sugar Land or in River Oaks, I think people are paying $300-400 for psychiatry.
Per session?
Yes.
So for the 12th session, they have to, then do they get any discount or it's just straight?
No, most insurances will pay for pretty much all of it.
So it's an expensive thing, of course.
Yeah, but not anymore. Like, again, organizations like Ibn Sina, like, Harris Health, like all these, there's several ways that children and adults can get psychiatric help, counseling, free screenings, like it's free to know what the problem is. You could just, book a session with one of our counselors and they'll look into it. And then even if you needed to see a counselor, our rates are super sliding scale. And everyone on our team is licensed and they're equipped to help.
That's amazing. So before we go ahead, I would like to take a short break and would like to say thanks to our sponsor, India House. This important topic has been brought to you by India House in collaboration with Hawk Foundation and Asian American Health Coalition. India House Houston is a vibrant, non-profit organization dedicated to uniting culture and enriching the greater Houston community. Through its diverse range of free programs and services, it addresses critical needs such as healthcare, legal aid, education, and wellness. From food distribution and charity clinics to yoga classes and cultural activities, India House fosters inclusivity and provides a welcoming space for people of all backgrounds to connect, learn, and thrive. Common misconceptions or misunderstandings about ADHD you would like to debunk?
I think the biggest misunderstanding is somehow there's something wrong with the brain. It's just a different brain. And the work is on us to figure out on how it's different and then accommodate. People with ADHD or ADD are not dumb. There's nothing wrong with their brain.
Is it a kind of mental illness also?
It's its own. So
I know it's a harsh word to say this. I'm not feeling good after saying this, that it's a kind of mental illness. But when I was reading some articles about ADHD, then in the article what I read is it is a kind of a mental illness also.
It's in it's just how our executive function, our attention. If you're nearsighted, you'll go to an optometrist and they will give you a certain glasses and accommodate you so that your eye can see the world and you can enjoy your life. Your brain is another part of your body. I guess to start looking at it in a fresh perspective, because how we talk about these things to our children, it can leave a mark for the rest of their lives. And they just wear that label, and it's missed opportunities. It's better to be preventative, be quick to get the help, get the right answers, and not judge that person.
Is ADHD genetics?
It could be.
It could be.
Just like, again, diabetes. If you have a poor eating habit and there's sugar in your diet, you can... So
if we, let's see, as we earlier discussed, that if you want to educate your child, you have to educate yourself.
Yes.
Right? As we discussed. So maybe it's not heredity, it's just you are perceiving the behavior from your parents. And it, lead to the ADHD or something mental health issue.
So not everybody, and this is something now that I'm a little bit older, I realize not everyone is equipped to be a parent and not everyone is equipped to be a teacher.
Of course.
Because I see a lot of cases where, an adult is lacking the self-regulation and the skills they need to function in their demanding environment, and somehow the child pays for it. And they come to a professional and they're like, fix him, medicate him, make him stop.
Yeah.
And I actually have had moms like, I want this kind of child. Can you make it happen?
Oh my God, that's serious?
Especially with some, different classes and different cultures. That fix-it attitude instead of... Yeah. And I said, let's get to know your child. How about you help me get to know your child? and then we can have a better understanding.
Can you highlight what kind of characteristics usually parents want?
Well, they want their house clean. They want their child polite, quiet when they want them quiet.
Oh my God.
No talking back. Whereas I actually
Are you making a robot? Are they planning to take a robot? Because robot only can do this. Okay,
Yeah.
now I want you to stop.
And that's
Stop.
what I mean. Not everybody. I'm actually glad the process of giving ADD or ADHD diagnosis is complex, because you can't just go based on one person's
Of course.
observation. The problem needs to be a problem at school, at home, at a new like social, let's say they started karate class and everyone is saying the same thing, then sure, take the issue more seriously. If not, take a look at yourself. Am I an effective parent? Do I have enough parenting skills? How could I improve? How could I engage my child and understand them? And 9 out of 10, there are some genetic components where we live with something, and the way we cope, we teach our kids to cope that same way.
So how can society fight against the stigma going around ADHD?
I think in spaces like this, in schools, I always tell my teacher friends, school counselors, I'm happy to come to your school, do free talks. If you have questions,
that's a very
email
good cause
me,
you're doing.
Reach out to me, because you're kind of saving a child their whole childhood.
Of course.
Right? From negativity, judgment. And that is how we make the future. We've already been kids. Like, we all need to make more effort to make it a better environment for kids, because they've got a long road ahead of them. And so awareness, talking, making it comfortable, being, authentic, not to try to just keep face for our communities, because then the person who's struggling will never speak up if everyone's protected. How about we train our eyes to see success in children, not just becoming doctors and engineers and successful, but how about we define success by kindness, by ability to cope, by how we can make, families better.
Like you're saying, you go to the school for the free counseling also. So how can an educator better support ADHD in school or daycare system?
Through education.
Only, yeah.
It goes back to the parent.
Of course.
You got to be educated to educate on that topic. In our training, so in my license, we're required 3,000 hours, and about 400 hours is like intense, where we are literally the patient. We have to face our own mental health, because we don't want to be in spaces where we're projecting our issues onto our patients. So I think education is key. Giving school teachers that support they need, they should have their own counselors.
Let's move to the adult side. How does ADHD affects behavior of an adult in relationships, in society?
The best way to describe how it's disruptive and frustrating on their part, because they live with this brain.
Yeah.
And other people are judging them. And sometimes they're not given the chance to explain. Whether it's a relationship, like we said, it's rejection, or you never listen to me, you jump topics. These things are kind of clues that person may be struggling with something.
Yeah. In last podcast, you said in our previous one, when we were covering kids' mental health issues, that there is a unique consideration. Sometime older adults are, diagnosed with the ADHD, and they didn't know that they were having this issue previously. Yeah. So what kind of considerations should adults who are diagnosed later in life keep in mind when exploring treatment?
Definitely start off with both. If someone gives you medication, keep the counseling like side by side so that
Okay.
you're learning the coping skills
Okay.
and,
Can you explain
organic.
the coping skills?
So a lot of what therapy is teaching, coping skills, adaptable skills, pro-social skills, like understanding what's a problem pattern and then how do we fix that.
So you should be accountable what you are doing.
Yes.
Okay.
And then if they have moderate to severe and if they need medication, those two things hand in hand will give them good results. Just like a diabetic patient, if they're given the medication, but the patient that gets the medicine, that walks 30 minutes a day, that talks to a nutritionist, that's the patient that will do the best, right? So it's kind of same
Go
concept.
hand in hand. Okay. A quick rapid fire and a fun rapid fire round. So what you have to do, you just have to answer in a line. Just a simple word or a line. Or if you would like to explain it, then you can explain it later on.
Okay.
Right? So a quick rapid fire with Mehtab.
Okay.
Mehtab, true or false? Medication helps heal ADHD.
False.
False.
Not
Today-
by itself.
Okay. Today, approximately what percentage of US children are diagnosed with ADHD?
Unsure of that answer at the moment.
Okay. Has a specific gene for ADHD ever been found?
There are some studies that have looked, and that's when we discussed the whole male and female. Before it was very biased that, more boys have it. But that's been debunked.
Do medications for ADHD primarily address symptom or root cause?
Symptom. And for severe, also the root cause.
What age is ADHD typically diagnosed?
As early as 4.
As early as 4. Okay, means in toddlers also. That's sad.
Yeah, not as, that's kind of when early childhood detection is usually from when you first become social, like so speech and the introduction of peers, and that's when we start observing these behaviors, like eye contact, like sensitivities.
Is ADHD hereditary?
Yeah, partially, yeah.
Can adults be diagnosed with ADHD?
Yes.
Till what age?
Any age, because they could have been diagnosed earlier, but they just toughed it out.
The last question. Did you like Safarnama with Shilpi interviewing with you?
This was fun. Thank you.
All right. Thank you so much, Mehtab, for
course.
all the answers. And I thoroughly enjoyed the session. It was very informative for the people who are really dealing with this sensitive, it's not a disease. It's just a kind of function that everyone, if you guys are, it can be treated as after, what I concluded, it can be treated. And if you are having this kind of symptom, just go and seek help.
Yes. And we have 4 psychiatrists. We have child and adolescent psychiatry. Like it's a easy, you don't have to wait to get in with our clinic. So we're there to help you. And a lot of my answers, I'm not a psychiatrist. I just try to give a general information. So thank you.
Thank you so much, Mehtab, for your time. I really enjoyed our conversation.
Thank you. Appreciate it.
This important topic has been brought to you by India House in collaboration with Hawk Foundation and Asian American Health Coalition. India House Houston is a vibrant, non-profit organization dedicated to uniting culture and enriching the greater Houston community. Through its diverse range of free programs and services, it addresses critical needs such as healthcare, legal aid, education, and wellness. From food distribution and charity clinics to yoga classes and cultural activities, India House fosters inclusivity and provides a welcoming space for people of all backgrounds to connect, learn, and thrive.